Thank you, Madam Chairman, and thank all of our presenters. I appreciate very much them being here. My first question would go to Dr. Fauci. The Food and Drug Administration reports that nearly 40% of finished drugs and roughly 80% of active pharmaceutical ingredients are manufactured abroad. During the COVID-19 pandemic, we saw factories shut down in order to prevent spread of virus, drug supply chains disrupted, and drug shortages increased. As a result, America's access to essential medicines was really put into jeopardy. As a preeminent infectious disease doctor, you know better than anyone how important it is to have access to essential medicine. So my question would be, Doctor, can you comment on the importance of a strong domestic supply chain for essential medicines, and how can we ensure we don't experience future drug shortages when the global supply chains are disrupted?
Thank you very much for that question, Senator Manchin. I think it's absolutely critical that we have the capability, independent of supplies from foreign countries, to be able to supply the necessary medicines that we need in the United States. I have been of that opinion for a very long period of time. The solution to the problem is to be doing much less of the outsourcing to foreign countries for the important ingredients of many of our medications. So right now we are not in that good position, and I believe, particularly since the disruptions of the supply chain that have occurred with the COVID-19 pandemic, that this might be a good lesson for us for the future to make sure we have much more dependency on what we can do domestically as opposed to in foreign nations.
Doctor, have you all looked at why has most of manufacturing left the United States, and why are we not able to manufacture, or are we at a disadvantage in the United States for other reasons, cost-wise, or basically different types of things that we make people jump through hoops and everything else as far as permitting and all that? What would be the cause?
You know, Senator, to be honest with you, I don't know why that's happened. I think it was because it was felt it would be much less expensive to get this done outside. But I don't really know the answer to your question of why we have so much of a dependency of important materials outside of the country. But certainly, whatever the reason, I believe it needs to be corrected.
Well, I need to work with you on that, Doctor, if I can, basically, in making sure this administration, I think they understand the urgency we need to start basically manufacturing again, not only just our drugs, but so many things in our country. So I look forward to your support on that. Dr. Collins, West Virginia is constantly ranked last in the nation for health outcomes. In 2020, the America's Health Rankings reported ranked my state of West Virginia 50th for premature deaths, frequent mental distress, and multiple chronic conditions. We also ranked last in life expectancy. What is the NIH doing to bridge this gap in health outcomes, and how do you ensure that the medical research that you do benefits people in poor rural communities?
Well, it is very troubling to see the fact that you've just cited, that health outcomes are not what we would all want them to be. And of course, there are many factors that play into that, Senator, and we are deeply engaged in research and trying to identify the ones that are addressable. Certainly one of the things I might point to is the increasing focus we have on disease prevention. If we simply are limiting ourselves to trying to help people who've already developed a serious disease, we've kind of missed the opportunity. Unfortunately, our healthcare system doesn't do a great job in that situation of providing support for disease prevention, and it seems happier to pay for things once people are already quite ill, so there's additional work that needs to be done there. One of the things that I think I'd point to is a series of large-scale efforts to really understand what are the factors that play out in people staying healthy or getting a chronic disease, or how you manage that. The All of Us program, which this Congress has supported, on the way to enrolling 1 million participants, including in West Virginia, is a way in which we can collect that kind of evidence, including their electronic health records and lots of information about their environmental exposures, and try to figure out in a holistic way, how can we take that information and bring forward a better chance for people to live not just a good lifespan, but a good health span. So we're deeply engaged.
Thank you, sir. Dr. Fauci, finally, you know, my home state of West Virginia is battling an epidemic during the middle of a pandemic. We've been devastated by the drug epidemic, COVID-19, and we now lead the nation in new HIV infection rates. You spent much of your career focused on prevention, diagnosis, and treatment of HIV/AIDS, and your research has been instrumental in saving countless lives in the United States and around the world. So, Doctor, what is being done to replicate testing and surveillance efforts we saw put into place for COVID-19 for other infectious disease like HIV/AIDS? and what public health infrastructure would be required to bring better infectious disease testing and surveillance to fruition?
Thank you for that question, Senator. The HIV testing situation, unfortunately, has been somewhat interrupted by the COVID-19 pandemic because of the interruption of multiple services. But as you know, we have a 10-year plan to end HIV as an epidemic in the United States, and that is going to require access to testing for those who are not infected, to put them on if they're at risk to pre-exposure prophylaxis, and those who are infected to immediately put them on antiretroviral therapy, because as we know, when you bring the level of virus to below detectable, not only do you save the life of the individual, but you make it essentially impossible for that individual to infect someone else. So testing is really at the fundamental basis of how you address the epidemic, and for that reason, it's going to be extremely important to get our testing capabilities back up to snuff once we get the country back on a degree of normality following control of the COVID-19 pandemic.
Thank you. Thank you, Madam Chairman.
Thank you. Senator Braun.